Brilliant. Let's get going. Good morning, everybody. Thanks for joining us this morning. I know lots of you are education colleagues who are on the final part of coming towards the summer, although I also know a lot of you will be doing considerable amounts of work over the summer. But I always believe that education colleagues have a kind of cellular feel for the routine of the year, and so at the end of the summer term, you know, it's kind of in your bodies, you feel exhausted and ready to stop work for a little bit. So hopefully this morning you can enjoy now with Rachel, our colleague from FTB, just thinking about anxiety and absorbing some of that learning. My name's Anna Robinson. I'm a psychotherapist by profession, and I work as the mental and emotional health lead at Birmingham Education Partnership. So I've been part of the team who've been looking at the kind of You've Been Missed campaign that we've started, which was originally around extended school non-attendance or emotionally based school avoidance or absence, but actually we've realised that over this time that kind of You've Been Missed hashtag is quite lovely for welcoming children back to schools and back to activities where we know they really have been missed, because schools are much happier places when there's more children there. So what we know is that people's feelings of anxiety have been raised over the last few months. I think anybody who has an underlying sense of anxiety at all, that's been triggered. So if you have, for example, some kind of health anxiety, that's heightened. Any kind of basic level of anxiety has kind of been raised. But we also know that when we understand anxiety a little bit better and what's happening for us, that can make it feel a little bit safer and make it feel a bit more contained for us. So Rachel kindly has said she would do a repeat of this webinar, which is great for two reasons. One is that more of you get to access it live, but also because we managed to mess up the recording last time. So it gives us a chance to gloss over that and do it again. So Rachel, I'm going to hand over to you to introduce yourself. I know you were saying a little bit about kind of cameras and microphones and things, but I'll let you say how you want to manage things and then we'll go from there.
Lovely. Thank you so much, Anna. So yeah, welcome everybody, and thank you all so much for joining. It's great to see so many of you. I know it's such a busy time, especially for teachers at the end of term, so I do really appreciate you joining. Some of you have just joined, so I'll just repeat what I've said before, which is that if you could just remain on mute throughout the training, that would be great. The reason being is just because a lot of background noise can be picked up on the microphone, so it's just a bit less distracting. But if you do have any questions or comments that you want to contribute as we go along, then please feel free to use the chat function. You can ask questions directly to me rather than making them public if you just select who you'd like to send the question to. And at the end, I'm going to make sure I leave enough time to answer those questions and have a bit of discussion if that's possible as well. So what we're hoping to achieve in this hour, and as I said, we have it is going to be quite there we go. We're hoping to really gain a deeper understanding of what anxiety is. So as Anna really nicely explained there, is that as soon as we know what is happening to us and what we're experiencing and why, it can feel so much more tangible and therefore so much more manageable. And that's a huge part of what we're going to talk about today. So before we can even start working out what is anxiety and what is worry, we've got to know what these things are. And then secondly, what we're hoping to do is help build your confidence as professionals in identifying the differences between what is anxiety and what is worry, because their responses, the required responses to different these two different emotions are very different, and what might be expected of you as professionals may differ depending on what this young person's presenting with. So hopefully by the end of this training you'll feel better equipped to differentiate those two presentations. So what we're just going to start looking at firstly is what anxiety is. So as I said, this psychoeducation is such a huge part of any intervention that we offer around any kind of mental health. So it's really important that you as professionals can have this level of understanding so that you can, begin to manage it within your own professional settings. So essentially what anxiety is, it's a feeling of fear or apprehension, and really importantly it's characterised by a number of physical symptoms, which is something that we're going to come into a little bit more detail on later on. But as you probably can all relate to, it's something that almost everybody experiences at some point in their life for different reasons and at different levels of intensity. But the really important thing to remember and the important thing to communicate is that it's not dangerous. It isn't something that can hurt us. It's not something that's going to have lasting physical damage on us. It's temporary, and we always recover. We always overcome these temporary feelings of anxiety. And we know it's a problem when it starts to impact our daily living, which again is something that we're going to come on to a little bit later on. So what essentially anxiety is it's a survival response. And the way that I'm explaining this to you all here today is exactly how I would explain this to a young person. Obviously, I might alter the language a little bit, but to any young people I'm working with, or to parents potentially. And it's because this is really, really important stuff to know. So as I said, it's essentially a survival technique. So if we think back to thousands and thousands of years ago, to the early years of mankind, back when hunting was a really key part of survival. This was a time when the human population was drastically at risk, and essentially these human beings back then were not equipped to survive, the environment that they were in back then, and the human population started to decrease. So as an evolutionary response, the body then developed what we now call this fight, flight, or freeze response, which is essentially the brain identifying this is a dangerous situation, this is something that's going to put us at risk, and this is something that we now need to respond to. So we can respond by either fighting our way out of this danger, we can flight or run away or escape this danger, or we can freeze, which is essentially hide or play dead, that sort of thing. And back then, that was a really, really useful response. And it was something that actually contributed to the human population. It meant that humans were surviving, they were more equipped, and the human population began to increase again. So this is something that actually has stayed with us as the years and years and years have gone by. However, of course, life nowadays really isn't how it was back then. We aren't faced with these life or death situations every day, like, cavemen and women were, in the early stages of mankind. However, it's really important that we do still have this fight, flight, or freeze, because, for example, if I were to cross the road, didn't see a car coming towards me, the moment I noticed it, I would want my brain to recognize that this is a dangerous situation and I need to respond here. I need to get my body to do something in order to probably run out of the way of this car. So although we don't use it every day or need it every day, it's really, really important that it is something that remains within us. What I've learned from doing this webinar last week is that we probably don't have time to go through this YouTube video, but I have put it on here because it just really nicely explains that fight, flight, freeze theory, and it's a great resource that you can share with young people as well. So I won't play it today, but it is there for you if you want it. So then that sort of brings us on to the question, okay, well, why is it that some people experience fight, flight, or freeze, or what we now call anxiety? Why do some people experience anxiety a lot and some people don't? And it's all to do with the way that the brain functions. So there's three particular parts of the brain that we always think about when we talk about anxiety. And that's the amygdala, the hippocampus, and the prefrontal cortex. However, in STICK, this is a really widely used analogy that we always use. And we instead use the meerkat, the owl, and the elephant to explain what the brain's doing. It wasn't developed by STICK. There's lots of resources online that kind of explain this analogy, so we can't take credit for it, but it's absolutely something we use all the time, and it's really, really good. And as I said, I would explain this using this analogy to children, professionals, parents, because it just makes sense and people do really get it when you explain it in this way. So the first part of the brain that we need to know about is the amygdala, or the meerkat. And we call it the meerkat because typically meerkats are up on their hind legs. They're very nervous animals. They're always on the lookout for danger. And that's essentially what this part of our brain is doing. This part of our brain's purpose is purely to maintain our survival. So it's the earliest part of our brain to develop, and its sole purpose is keeping us safe. And young people who have a lot of anxiety, we always say they've got very active meerkats. So they've got meerkats always up on the hind legs, always on the lookout for danger. And it's this part of our brain that activates our fight, flight, or freeze response. And again, the way I explain it is if to imagine there's almost like a big red button in the brain, and anxious young people, they have meerkats that hover their hand over this button all the time, and they're constantly responding and pushing that fight, flight or freeze button, even when they don't really need it. So even when they're not in a life-death situation. And that kind of brings us on to think about, okay, so why do some young people have anxious meerkats and why do some people not? And it's all to do with the elephant part of our brain, which is the hippocampus. We call it the elephant because apparently elephants have brilliant memories. So this is the part of our brain that stores all of our experiences. So where we've been, the people we've met, but really importantly, it remembers how we felt while we were doing these things. And the elephant and the meerkat have quite a special relationship in the sense that the elephant will feed information to the meerkat. So it will remind the meerkat, we've been here before, but do you remember how awful it was while we were here? Do you remember how unpleasant this experience was? And typically, you know, young people with anxiety tend to have had maybe difficult starts in life. In some situations, they may have had lots of difficult experiences. And what we say is that elephants held on to that. And rather than feeding all the positive information to the meerkat, it feeds the negative. So for anxious children, they might have had, you know, 100 scenarios that went well 99 times and went badly once. Yet their elephant remembers that one time it went bad, feeds that information to the meerkat, who interprets that as being, this is really serious. I've got to, you know, protect from this awful experience happening again. So I'm going to switch on this fight, flight, freeze response, which is what we now know as anxiety. And then we have the owl or the prefrontal cortex. So this is, we call it the owl because, you know, we categorize owls as quite intelligent, wise animals. And this is what this part of our brain does. So it's our rational part of our brain. It provides reasoning and logic, except this is the part of our brain that in females doesn't finish developing until they're in their 30s. And it's not until males reach their 20s that their owls are fully developed. So actually it makes a lot of sense that young people have worry and think irrationally sometimes because actually this part of their brain isn't fully developed. But in young people, there can be some children who have further developed prefrontal cortexes than others. And essentially what should happen, or what we would hope would happen, is meerkat starts to panic because of information the elephant shared. But before he switches on fight, flight or freeze, the owl has come along and said, hang on a sec, we don't need to panic about this. We don't need fight or flight for this. Do you remember the 99 times that this actually went well? And when the brain is able to do that, it prevents this child reaching those really high states of anxiety where they experience these physical responses. So it prevents this fight, flight or freeze response. So that was sort of a whistle-stop tour on the brain and what anxiety is. What I will say is that all of this slides will be shared after the webinar today, but I've also put together a document because I know these aren't very detailed slides. I've put together a document with a lot more information on it. So if you were to cascade this down to colleagues, or if you wanted to present this yourself, there's a lot more information that goes along with each slide. So I do apologise, there's not a lot of information, and I'm aware I'm whizzing through it, so I do apologise again. But what we're going to start thinking about now is how to identify the differences. So how to know whether a child has experienced anxiety or whether this is worry. And this is a really, really helpful image to explain that. So the first difference that we would typically see is the ability to problem solve. So this graph, what it demonstrates, so in the green section here, this is, well, overall the graph demonstrates the relationship between stress levels or anxiety and performance. So in the green zone, what you have here are the young people that you might work with that have absolutely no cares in the world. Everything seems to just kind of fly over them. They don't seem to have to grasp the sense of urgency of things. They're very laid back, but they're also the young people that aren't motivated or driven to do well. And because of that, they tend to not perform as well. And then you've got the yellow zone, and this is where your worried children sit. So worry is a really, really helpful motivating force for us all. So if we didn't fear consequences, we wouldn't conform in the way that we do. So for example, we wouldn't you know, do what we're supposed to at work, or, you know, in school we wouldn't behave the way that we're supposed to behave if we didn't fear consequences or the repercussions. So actually worry does help us. It's something that can keep us on track, and it can motivate us. And that's what we can see here in this yellow section of the graph. So this is the optimum zone. So the worried children sit here because they have enough discomfort to make them do what they need to do. So they might have a meerkat who starts to think about the negatives, who starts to think about these consequences. But equally, they have an owl that comes along and says, don't worry about this, don't get overwhelmed by this, this is what we can do to manage this. And that's why they then perform really well. But what we can see in the amber zone is where it tips from worry into anxiety. And that's because at this stage, their meerkat switches on fight or flight. So the key difference is the owl. So worried children have an owl who can come along and problem solve, whereas anxious children don't. They have a meerkat who worries and then switches on fight or flight because they haven't got that part of that brain that comes along and rationalizes. So what happens then, of course, is they have these anxious fight, flight, freeze responses in their body, and that then becomes more of a hindrance than a help. They're no longer thinking logically or rationally. That part of their brain has not been activated, and they enter, you know, what we can sometimes see as full-blown anxiety attacks, burnouts, just at the stage where they aren't able to perform or function. So what I hope is made clear now is actually what the differences are. So, and really it's that ability to problem solve. It's the ability to, yes, maybe feel anxious, but to also manage that anxious situation. And that's what the difference is between worry and anxiety, because worried children can do that and anxious children can't. And that brings us on to the second difference that we'd see between the two, which is the duration. So the National Institute of Clinical Excellence, which is a diagnostic guideline for mental health, what that guideline states is that for generalised anxiety disorder, they would typically expect to see a young person experience significant stress or impairment for more days than not, and for a minimum of a 6-month period. So one thing to say about that is that I take that with a pinch of salt, because I think by the time you're all, you know, back to work, back to normality, potentially young people are back at school, there will have been a really long period of uncertainty, probably a long period of anxiety, specifically around COVID and life and all the knock-on effects that that's had. But I wouldn't necessarily say that that means that all these children are anxious because they've had this for over 6 months. I think this is a really unusual time. It's certainly an exceptional time, and I don't think it necessarily means that they will all be experiencing anxiety. What it will mean is it gives you the opportunity to really look, okay, when they're back in this normal environment, life has kind of returned back to normal as much as possible. That's where the key points are. That's when it's really important to say, actually, how are they managing now? Now are they able to problem solve? Because they're not in that environment anymore. Life is sort of back to normal. Are they now able to do that rational thinking and apply problem solving skills? So that's the general advice, but I would take that with a pinch of salt. And then I've got some scenarios here just to explain the section where it talks about having anxiety on more days than not. And hopefully these scenarios can help explain it a little bit better. So an 11-year-old girl once missed her stop on the bus because it was rainy and she couldn't see out of the windows clearly. She felt panic and worry the moment she stepped off the bus and realised she wasn't where she should be. But she was able to get back on the bus and successfully travel back to the right stop. Since this day, this girl has felt nervous whenever travelling in the rain in case something happens again. So what we can see from this example here is an example of worry. So the issue is only when it's raining. So it's not a problem she has every single time she gets on the bus. This is something that only happens when she rains. So it's not every day of the week. But also what we saw is that she was really able to problem solve. So she felt that panic. She noticed her meerkat, you know, switched on. She noticed her meerkat started to do some of that thinking. However, we also see that her owl came along and problem solved and said, we just got to get back on the bus. And she managed that situation fine. In comparison, this scenario describes an 11-year-old girl who once missed her stop on the bus for no clear reason. She travelled on this bus many times before, and this had never happened. When she got off the bus and realised she was not where she should have been, she panicked. I've lost my train of thought. There we go. So she struggled to think clearly and could not work out where she was. Eventually, a member of the public helped her call her parents, who came to collect her and brought her home. Since this point, the girl has had meltdowns every morning about getting on the bus in case the same thing happens again. So what I hope you can see here is that this is a kind of a scenario that would describe more of an anxious presentation for a couple of reasons. So there was no clear reason that she missed this bus stop. It wasn't because of the rain. So actually, every time she goes to get on this bus, her elephant will say, do you remember the last time we got on this bus? Do you remember how awful that was? Particularly because her experiences were not a positive one. She wasn't able to problem solve. She wasn't able to resolve the situation. She panicked and she wasn't able to save herself, essentially. So what the elephant is going to remember is, do you remember how awful this experience was? Do you remember how upset you were? But importantly, Meerkat, do you remember we needed fight or flight in this situation? We weren't able to avoid fight or flight. Whereas in the other scenario, she felt panic, but before she went into flight or fight mode, her owl had come along and done some of that helpful problem-solving behaviours, but that hasn't happened here. So what unfortunately happens is her elephant remembers fight, flight or freeze is what's needed. Every time we get on this bus, we're going to need fight, flight or freeze. So it becomes an automatic response that her body does and her brain determines is necessary every time she gets on this bus. So we can see that this is something that she would experience near enough every day. Whereas the other example is something she may experience if it's raining, but she's got the ability to problem solve. Her owl would remind her Meerkat, we've been here before, we managed this fine, we can manage this again. This young girl here in the anxiety example hasn't got those positive experiences. And what is likely to happen is she's likely to form what we'd call a vicious cycle, which is something that we're going to come on to a little bit later on. That, again, links quite nicely to the third difference, which is the nature of the concern. So generally, worry tends to be a lot more specific than anxiety. So a worried child is far more likely to be able to say to you, I'm worried about, whereas an anxious child may struggle to do that. And there's a couple of reasons for that. And that's because a worried child still has that owl. They have that ability to access that logical and rational part of their brain. Meerkats don't understand language. They don't understand reasoning. So an anxious child who is purely functioning from their meerkat brain, when you're asking them, what are you anxious about? Then in that moment, they can't communicate. That's a part of their brain that doesn't understand language. So they're very unlikely to be able to talk to you while they're in that anxious state. But also what we now know is anxious children also experience fight, flight or freeze. Their meerkat pushes that button, which of course starts these physical responses. So they almost leave the cognitive space. They're no longer thinking. All they're doing is experiencing, they're feeling. So when you speak to a child with anxiety, very often they talk about the feelings they're having. So I feel sick, or have, my chest is hurting me. So they're no longer worrying about or thinking about what the trigger was. They're just trying to deal with that physical response in the moment. So they almost miss the opportunity to catch what that trigger was. Whereas worried children, they don't enter that fight, flight or freeze mode. They stay in the brain, they stay cognitive, and as I said, they have a helpful owl who can come along and do that communication. So when you are talking to young people, if they're able to be specific, generally it means that they're still functioning from a helpful part of their brain. If they've gone into that sort of physical response, they're likely to be experiencing their fight, flight or freeze. Again, that leads us really nicely onto the fourth difference, which I've sort of started to explain. It is the physical presentation. So as we know, when children experience anxiety, the meerkat will switch on this fight, flight or freeze response. And what that is doing is essentially preparing the body to either fight, to run away, or to hide, or to play dead, whatever it may be. So the body goes through a huge amount of physical changes in order to prepare for that. And I've put this graph up again just to demonstrate the difference, the point at which that changes So obviously the yellow is the worry, where we're not in fight, flight or freeze. And then anxiety is the amber zone, where that's been switched on and all of a sudden we have these physical responses. And it's really important that this almost falls into the psychoeducation part that we did at the very beginning. And whenever we work with any kind of family, or whether it's young people on their own about anxiety, we would always do this bit of psychoeducation with them, because knowledge is power. The moment you start to really understand what is happening to you, that's the moment it's no longer fearful. As Anna was describing before, it becomes safer, it becomes more bearable. It's also more tangible as well, because anxiety, what is it? It's just, it's very hard for young people to grasp. So if we're giving them actually concrete knowledge, this is what's actually happening to you and this is why it's happening, that all of a sudden starts to make so much more sense for them. So these are some of the common physical responses young people complain about when experiencing anxiety. And it's really important just to explain to them what the function is of each of these responses. So what typically starts first is their breathing changes. So for some young people, it's that they breathe deeper or quicker, or maybe they struggle to breathe. It can vary quite a lot. But the reason for that is because the body's trying to intake a lot more oxygen, because oxygen equals energy. So the body's trying to, get as much energy as possible to prepare for fighting, running away or freezing. And because we've got this influx of oxygen, it gets transferred into our blood, but then it needs to be pumped around the body quicker. And that's why we can experience an increase in our heart rate as well. That's typically where sometimes young people experience actual chest pains. They can say my chest hurts, and that can be just as a result of their heart rate increasing. So of course, when all this extra, so of course the oxygen, and they produce adrenaline as well. Once all of that's being pumped around the body, it tends to go to the muscles that are more used more frequently in fight, flight or freeze. So that's things like the arms and the legs. So that's typically where young people experience maybe tension, shaking, clenched fists. Lots of young people can experience like feeling weak or feeling shaky as well. And that's just because the body's had this influx of oxygen, influx of adrenaline, and it's trying to burn that off. Because remember, we're not actually fighting, we're not actually running away, we're not actually freezing, so we're not doing anything different. Yet our body's going through extreme changes. So it will do things to burn that energy off. So that's usually by shaking, so contracting and releasing the muscles really quickly to burn that energy off. And that's why these young people can experience these feelings. So as well as this additional energy that they have, the body will draw resources away from parts of the body that aren't being used in fight or flight. So things like the stomach or the bladder. So young people can actually experience like incontinence sometimes when they're anxious. That's why young people can sometimes wet themselves. It's also why they can get headaches sometimes, because resources are rushed away from the head. They can get quite dizzy and lightheaded. Sick feeling as well. Some young people experience stomach pains. Maybe it's like butterfly, like an empty feeling or a sick feeling. And again, it's just because these resources are being pulled away from the stomach. And because of that, the body's working so hard internally. We've got all these different internal responses all happening at once. The body can increase in temperature, but then of course, as a response to that, we can then sweat and drastically decrease our temperature. So young people can experience both, either feeling really, really hot during anxiety or sometimes really cold and shaky. So it really can vary. What we always encourage is to help them understand what it is specifically that they experience. So some young people are able to do that. So again, if they're a worried child, they may not experience these physical symptoms so much. So if you ask them, what did you feel? They may say things like, I felt like crying, or I felt scared. But actually, if they're really experiencing these anxious feelings, they'll say, I felt my chest was hurting, or I felt dizzy, or I felt like I was going to faint. Some young people, you can almost see they're experiencing, but just struggle to identify what the actual responses are. So it's almost about displaying, this is what could have been happening to you. Did you think you noticed this happening? And we'd encourage them to map it all out almost on an activity sheet such as this, because again, it just becomes more tangible for them. They can almost see what they're experiencing in those moments. And as I said, the moment they know what's happening, they know that this isn't something scary. This isn't our body, something really seriously wrong with it. This is our body just trying to keep us safe. And that's the message we always try and deliver, is this is your body trying to keep you safe, because then it really doesn't feel so scary. And that in itself is a management technique. That in itself is something that can reassure the meerkat, reduce the fight or flight symptoms, and help them return to that calmer state. I've just put this on here because this is something that I did with a young person. She was only in year 1, so she was quite young, but it just demonstrates how actually, if they're really experiencing true anxiety, they can tell you, they can notice it, and they can say, yeah, this is what I feel. And then you have the opportunity to say, this is why you're feeling it. And even as young as children in year 1, she really understood it. So she could barely write it, but she could understand it. And what we were able to do from an activity such as this is identify what her early warning sign was. So that's really, really important, because an early warning sign is basically the first physical response they notice happening. Because very typically young people, it can feel like it goes from 0 to 100, but it doesn't. There is always a process to it. One thing will always start first. And if you're able to give them that piece of knowledge, what you're then giving them is the chance to do something about it before it gets to that stage where we're in full-blown flight, fright or freeze, and we can't do anything other than just wait for the sensations to pass. So that early warning sign can be really, really key. But hopefully by seeing this example, you can see actually it can be really easily used with young people, and they really do get it and they do take it on board. Okay. So what we're moving on to now is the 5th difference, which is the impact it has. What I've got here on the screen is what we'd call a CBT, a cognitive behavioural therapy cycle, a vicious cycle. The reason I've put this on here is because CBT is the preferred method of intervention for anxiety in young people. It has really, really good impact. And I'm CBT trained, but there's lots and lots of young people, there's lots of people in the stick team, who aren't CBT trained, but use CBT informed techniques. So I don't want this to scare anybody and think, gosh, this is for therapists, because it's not at all. And what this theory is, what the CBT therapy is, it's essentially the understanding that everything that we do stems from the way that we think. So again, it's what the meerkat thinks, which triggers our fight, flight or freeze, which then drives a particular behaviour. So hopefully this will explain it a little bit better. So the situation is walking to school. We're going to use this example as being Alex. So previously, Alex failed a maths test. Okay, so he's walking to school and his elephant goes, hang on a sec, Alex, remember that maths test we failed? You're going to fail the test today. Everyone's going to think you're stupid. You're going to let everybody down. You're not going to get to go to the college that you want and have the career that you want. You've ruined it all for yourself. Those thoughts in that thought bubble, that's a meerkat thinking. Okay, so it starts from the elephant who reminds the meerkat to remember how awful this situation was, and that triggers the meerkat to start having these what we call negative automatic thoughts. So these intrusive negative thoughts that just kind of pop into our head. And because of those thoughts, the meerkat then of course thinks, right, this is awful, I need to protect Alex from this, so we're going to switch on fight, flight or freeze. Let's get him out of this dangerous situation. And that's when he'd experience, his heart rate increasing, his breathing increasing, legs shake, his hands became sweaty, and he was feeling really sick. And that's his early warning sign, is that sick feeling in his stomach. And because of that, his body reacted. So he turned around and he refused to go to school. But then, of course, what happens is when he gets home, meerkat goes, I've done a great job here. I've got Alex home. He's safe. He avoided that awful maths test, which was what we were trying to protect him from. I'm going to give myself a massive pat on the back here. I've done a great job. So of course, when it comes to going to school the next day, the same thing happens. Elephant goes, hang on a second, meerkat, do you not remember what happened yesterday? Do you not remember how we needed, fight, flight or freeze? And the meerkat, of course, then repeats the cycle. And that's why we call it a vicious cycle, because it can just go round and round and round and round. And that's what's really key here, between differentiating between anxiety and worry. Because a worried child, yes, they may have these anxious meerkat thoughts, but before fight or flight is initiated, they have an owl that comes along and says, hang on a sec, that's not what's going to happen here. And I've got that demonstrated on this next cycle. So it's the same scenario, walking to school. Yes, we may have those initial meerkat thoughts, but we have an owl that comes along and says, hang on, we've only failed one of those maths tests. The rest went fine. We've got a tutor for maths that helps me achieve my grades. My maths teacher's really nice. I know they give me extra support if I needed it. And my place at college is not determined by this one maths test, by this one exam result. And because of that, we've avoided fight, flight or freeze. And that means we're able to go on with our day as planned. We're able to attend school, and he actually ends up performing well on the test because he's got a bit of worry. He's not completely unbothered by it and unfazed. He's got enough worry that motivates him to do well in this test. And of course, that is then something that the elephant remembers next time walking to school with a test. Actually, we didn't need it that time. He did really, really well. And we avoid this negative cycle that we mentioned before. So you can see how they all kind of play into one, all of these differences that I'm explaining here. But this is a really important one, impact. Because if you're physically seeing it impacting on their day-to-day living, it means they're in this vicious cycle. Their behaviours are being affected, which of course you can see also how that then really leads to duration. You can see how actually this could go on and on and on and on and on, and potentially on for over a 6-month period. That school avoidant one that I was explaining to you before. So impact is really important. And these are some of the really common ones that you may see. So in younger children, typically, they're slightly more irritable, tearful or clinging. Sleep is usually impacted. They have a lot of sleep disturbances as well. So maybe that's like waking up in the night with bad dreams or sleepwalking, that sort of thing. Bedwetting, again, complaining of tummy aches or feeling unwell, and that's again their physical responses that they're explaining there. They're a bit more tense, a bit more fidgety, and using the toilet more often. Whereas in older children, you might notice a lack of confidence when it comes to trying new things, going to new places, meeting new people, simple tasks that previously they would have been able to do. The concentration may be impacted. Again, sleep and eating patterns are affected. Anger as well is a really typical anxious response. They can present in quite an angry way. And again, avoiding everyday activities, not seeing their friends, going out in public, not going out in public or going to school. I bet describing that, a lot of you thought that sounds like half the kids that I work with. So I guess what we always say is it a marked change? Is it something that they would previously be able to do but now no longer are able to do? Or is it beyond that just normal, moody teenage behaviour? Is it something more than that? And if you aren't sure, then it's about speaking with parents as well, because of course you only see them in their professional, in the professional setting that you work in. Be inquisitive, speak to parents, and see what they're seeing at home as well, because very often you'll notice the anxiety is across the board. It will be having an impact in general areas. So that's a really important point as well to make, is that that's sometimes all we have to determine whether a young person is anxious or not, because we aren't privy to the thoughts, to their physical sensations. Their behaviours is all we have sometimes. So that can be this is a really, really important difference for you as professionals in order to help sort of make that determination. So typically some of the behaviours that you may see, so what I've done is put it, so it says parents and teachers, but I think it applies for all professionals. What a child with anxiety may be doing and how that presents behaviourally in these settings that you work in. So reassurance seekers, which may look like clinginess, asking for help with things that you know that they can do themselves. They would rather avoid situations that they feel scared or worried about. So that again might look like them not wanting to go to school, not wanting to leave parents or sleep without parents. They're all trying to get others to do the things that they're worried about. So you'll get a lot of, will you do it for me? Can you ask for me? That sort of thing. The physical pains, again, these are the kids that complain of their headaches or their tummy aches. They do not like risk-taking behaviours, so they're always worried about doing the right thing. They're the types of kids that will sit back and watch and let everybody else try it out first. They're very fearful, so they're scared of the dark, dogs, injections, anything that there is to be worried about, they're worried about. And that can be because once this meerkat starts, it's very easy to remain vigilant. So if a young person has got a particular worry that they're exposed to every day, maybe it is something like going to school, what happens is their meerkat just remains vigilant, it remains on alert, and then starts to form concerns about other things that previously weren't a worry, that previously didn't cause them anxiety, but because their meerkat is now looking at the world from a very different perspective, they become a threat and they become a concern. So actually what may start as one very small worry, you can see how it really easily builds and escalates to anxiety about lots of different unrelated topics. They get upset very easily, so lots of crying, they can be quite sensitive. Again, their meerkat perceives things very differently, so they're a threat to me, they're teasing me, as opposed to it being just, you know, general banter between friends. And they're very cautious. Again, they see the dangerous side of everything because they've got this hypervigilant meerkat. So I hope that's been helpful. There's, as I said, the 5 key differences in identifying the differences between worry and anxiety. But what I've also put in this presentation as well is a little bit about what you can do in terms of referrals for young people and the differences between worry and anxiety. So the first one, if it's a worried child, we do have our pause drop-in centre. Some of you probably have heard of it or may have even accessed it. It's a centre based in Digbeth. You don't need a referral, you don't need an appointment. Any professional, family, young person can drop in at any time and they have sort of immediate advice and support on the day. At the moment, of course, they're not open, but they are running a telephone service. So they will, if you can either drop them an email or give them a call, and they'll arrange a time to call you back, and they'll speak to the young people and offer, like, you know, advice over the phone. And that's for any age, any young person can access that. Open door youth counselling. Again, I don't believe that they're running at the moment, but typically they're a brilliant service to offer counselling for this sort of emotional based concern, and that's any age between 12 and 25. And then Couth is another service that we often refer to. Again, it's online counselling, but it's brilliant because it's CBT based, so it's quite similar to some of the bits that you'll have seen today. But also the young people have a lot of autonomy, so they can choose who they would like to work with, so they get to choose their therapist, they get to choose how frequently they'd like it, so it can be quite good for these young people who are quite anxious about entering any kind of support. And that's for ages 11 to 25. And then if you feel like a young person is presenting with anxiety, so they've got these physical presentations, it's a daily occurrence, it's been going on for an extended period of time, you can tell they just aren't doing that logical thinking, that aren't problem solving, that sort of thing, and it's about lots of different things, then it's likely to be anxiety. And this is where you can either go ahead and make a referral if you feel confident enough. Our referrals are all online on our website, or you can call ahead to our access centre first if you're not certain and you feel, oh, jumping in with referrals too much of a big step. You can call our access centre and you could speak to a clinician first, and they would be able to guide you through whether that's, you know, appropriate to send the referral in or not. Forward Thinking Birmingham are offering support through COVID, depending on which area of the service that they go to, but you are still able to send referrals in, and they are being accepted at the moment. Lovely. I think I did that a little bit more efficiently than the first time round.
Record time, Rachel. Record time. Yeah. Thank you. Thanks ever so much, Rachel. I know I'm glad we've got some time for questions and things. So, I mean, I guess from my perspective, what I think is really helpful is just kind of having the language and the metaphor, I think is really useful for people in trying to understand some of this stuff. So I know I use that quite a lot in client work as well. And my only other observation is always around helping young people understand that they feel anxiety rather than having it. You know, it's not something you catch like a cold, it's a feeling and it's an experience that you have. So encouraging them to notice it as a feeling. So are you happy to take some questions if people want to type them into the chat box? So yeah, if people do have questions or anything they want to ask, then do feel free.
Just going to see if I can catch up on the chats from before. Ooh, I might actually close that. There we go. Might be a bit easier.
And just to say, if anybody has missed it, you will get copies of the slides. So I know somebody was asking about the contact information at the end of slides. So the slides will come to you as you've seen them today. So all of those referral routes and things will be on the end of there, won't they?
Yes. So yeah, everything will be on there, and you'll also get, as I said, the slides and then another document with a little bit more information on it, because I know I talked through a lot of the information, so you'll have it all there down on paper as well. Just realised as well, I didn't do that poll at the beginning.
Well, let's do it now.
Yeah, so if everybody would mind, so we're going to pop a poll up now, just asking you some questions based on the beginning of this intervention. So before you had all this knowledge, please answer these questions as if we hadn't just done. And then we're going to give you another one to score for afterwards, if that's okay. So simple multiple choice. So again, just before you had all this information, how would you have scored these questions? You would forget that. Yeah, I was thinking, don't forget it, and I did. There was a couple more people left to score it. Oh, thank you all for the feedback. That's really kind. Thank you.
Rachel, can you say a little bit just about the STIC consultation service as well, just in case anybody who's with us today hasn't used it or doesn't know how to access it and what you offer?
Yeah, absolutely. So a bit like how I was explaining our access centre, that number that I'd had on that slide there, it's similar to that in the sense that if you're not sure what this child needs, and it doesn't have to be anxiety related, it can be any emotional or mental health need. If you're just looking for a bit of advice, you think it could potentially be something that you'd send a referral into us for, but or even if you're pretty certain it's not for us, but you're thinking actually where does this child's referral need to go, you can contact us at the STIC team and we'll offer a consultation to talk that through with you. So in order to do that, you just need to email into our STIC inbox. I'll put it on here on the chat so people have got it. Send that to everybody. So BWC. So we do a response to the request within a couple of days. We normally get back to you on the same day, just saying when's a good time to talk, and we'll just talk through the concerns that you have, and we'll hopefully point you in the right direction. So anybody can access that at the moment. Oh yeah, you put it on there already. Brilliant. So happy to answer any more questions if anybody's got any more. This is going to be the poll that you score now that you have all this knowledge. So this is the one I should end. So again, if people could just answer those as best you can, that would be great. Thank you. Yeah, so we are doing a lot more polls and webinars in September, aren't we? Not just anxiety, we've got anger, self-harm, low mood, self-esteem. There's loads and loads of other ones coming up, but we were conscious of getting the anxiety stuff out, particularly for teachers, before the summer holidays. So yeah, the rest will all commence sort of in September time.
Yeah.
Thank you. Thank you, everyone. If everybody would just mind putting a comment, if you feel comfortable to, on the chat box, just a bit of reflections, really. It's helpful to have the poll, but all of this qualitative data is great as well. So if you could just write a couple of words, just how you found the webinar, that would be great. Thank you.
And also, I guess, if there are other things that people are struggling with that, you know, they think we might be able to do more of these kinds of things around. I know that's been a request that's come through before, if there are particular themes and things that are around. And I'm just noting there's a question from Lucy about other services for younger children. So of course your consultation service is for
school-aged children. Yeah. So yeah, if you age child that's attending school, a Birmingham-based school, it has to be. But yeah, we're able to offer some advice and guidance around that.
And also the pause service, of course, will still be running over the summer, won't it? So I know Laura Roden, who's the lead at Pause, has been quite kind of committed, I think, to being able to help, to be able to offer some support to parents and things over the summer. So their information's on the back of your slides anyway, isn't it? But I know that she's kind of trying to make sure that they can offer advice and things for parents as well. So kind of thinking about younger children as well, that might be quite useful.
Absolutely, and that tends to be the approach if they're particularly young. As I said, we have done interventions for young people in like year one. However, very often the case is that actually the intervention needs to be aimed towards parents at that stage anyway. But I was just looking, I'm so sorry I couldn't see who it is. Somebody had asked a question about what do you do if you think a child is actually worried and they believe they've got anxiety. I would be asking these questions and giving them that psychoeducation. So pointing out to them how long have they been worried about this for, pointing out to them what their brain is doing, and if they've got those problem solving skills, really bringing their attention to that, you know, highlighting the positives, look what you have to do, and again just really normalize it, explain that this is something that everybody has. And it's okay, and explain how helpful it is as well. You can, maybe not that chart, but you know, information from that graph that I had, which is that worry can be really, really good sometimes, and it's not always a bad thing. But I would just really get them to explore their own experiences. You know, are they having physical responses? Are they having helpful owl thoughts as well? And that sort of thing. So I get that that's, I've never had it that way actually, that they can, well, I have. It doesn't tend to happen as often that they're convinced they're anxious and they're not. It's normally the way around. But yeah, that would be my advice. I hope that's helpful.
I guess I was just thinking as well about what you were saying about normalising things. So thinking about children in particular coming back to school in September. And, you know, I know myself what it's like when you've had a break from something and you need to return. Like re-entry into anything is really hard, isn't it? So, you know, if you've had a holiday from work, or, you know, the experience of going back to work after maternity leave will be one that, you know, lots of women, you know, will be able to identify with. That actually sometimes it's just getting through the threshold and then your anxiety is calm, because anxiety is often about a fear of something in the future. So it's that normalising that actually everyone feels like that when they've been away from something for a little while. That's quite normal, it's quite usual. The normalising is a really important thing to be able to do.
Absolutely, absolutely. The stick consultations, it's just for professionals. However, parents are able to call through using that access centre number that was on the slides before. Parents can use that. Parents can even refer their children themselves if they'd rather do that. But yeah, the stick consultation is just for professional use.
Yeah.
Brilliant. Thank you all for the poll questions as well. That's really helpful.
Somebody was also just asking about kind of coping with anxiety and things. I'm just going to pop on a link to a website that I think has got some really lovely grounding exercises and things on it. So so you can have a look at some of them on there. But also don't forget that things like when a child is feeling really anxious, or when anyone is feeling really anxious, our tone of voice and things really matter. So So how we're talking to somebody, our body language, the pacing that we use is also important in trying to calm some of that down and create a feeling of being safer.
Absolutely. So the meerkat doesn't understand necessarily language, but it responds to facial expressions, voice, pace, pitch, all of those things. So they may not respond to the words, but they will absolutely respond to the energy that you give them, I guess. So if you get pulled into that panic, you almost kind of reinforce it, which is easily done. When you see a child in distress, it is easy to become distressed as well. But remember that it really does have an impact when you just put that calm energy back. Any posters? I think the You've Been Missed campaigns have released, I don't know if they're posters, but definitely some more information specifically on the meerkat, owl and elephant. I don't know if it's been released yet or if it's in...
There is some. I put the website on there somewhere. I'm just scrolling back to see whether I can find it. I'll just go and get the link again and I'll post it again for you.
Oh, thank you.
It's all right.
Okay. Do we have any specific work with looked after children in response to worry and anxiety? Not in particular. So us in Stick, we don't have a different service for looked after children. There is a looked after children service within the core FTB team though. But then that has quite a very specific criteria. If it is about still worry and anxiety, my advice would be to just offer the same support and intervention as you would with any young person. If their concerns are specifically around their social situation and the fact that they are looked after, then there is, as I said, a specific service within FTB. But if they're just presenting with that generalised anxiety or worry, then my advice would be to just respond in the same way as you would any other child. Thank you, everyone.
So I'm aware we're coming to the end of our time together. So if there are any more questions, do just post them. But otherwise, feel free to go about the rest of your day and go well. For those of you who are approaching the end of term, really do have a break and look after yourselves because everybody needs it. And for those who are working through, still look after yourselves and have breaks because everybody needs it. So go well, everybody, and go gently, and hopefully we'll see you at another of these sessions, perhaps in the next, I was going to say the next year, I mean next school year.
Yeah, no, I hope everyone has a lovely summer holidays. And as I said, if you've not already, just put a comment on the chat box if you feel comfortable to, then please do. And then, as Anna said, you're free to go about your day. Thank you, everyone. Thank you.
People are also polite, aren't they, in these things?
They
I love
are.
it. Everyone's
so kind,
so friendly.